How to ask questions at a doctor's appointment in English. Hello, and welcome to Real English Conversations. I'm Emma.
And I'm Daniel.
If you're learning English and you sometimes feel nervous speaking, especially in important situations like healthcare, you're in the right place.
Yeah, because today we're tackling something that can feel really intimidating.
Oh, absolutely. We focus on real conversations, not textbook English.
We talk about what people actually say and what they really mean in everyday life.
And today's topic is crucial because it's about your health and well being.
How to ask questions at a doctor's appointment in English.
Now, this is a big topic, so today we're giving you a general overview.
We're covering the essential questions and phrases you need for any doctor's appointment,
But in future episodes, we'll dive deeper into specific situations.
like going to the emergency room, talking to specialists, or understanding lab results.
So, if there's a specific healthcare situation you'd like us to cover, let us know in the comments.
For today, we're focusing on the foundations that will help you in most appointments.
This is so important because you need to understand what's happening with your body and your treatment.
And your doctor needs to understand you clearly too.
Before we dive in, if you enjoy this episode, please subscribe to the channel and give the video a like.
It really helps more English learners find us, and we're building such an amazing community here.
All right, let's get into it. Why doctor's appointments feel overwhelming. Okay, so let's start with why talking to a doctor in English can be so stressful.
Because it genuinely is. Even native speakers sometimes struggle with medical conversations.
Exactly. There's so much medical vocabulary,
Words you've never heard before, complicated terms.
and the stakes are high. You're talking about your health.
You need to describe symptoms accurately,
You need to understand instructions for medication.
and you need to know what questions to ask.
Plus, if you're new to a country, the whole healthcare system might work differently than what you're used to.
Right? In some places, you call the doctor's office yourself. In others, you go through a clinic.
And then there's the fear that if you don't speak perfectly, the doctor won't take you seriously.
Or that you'll forget to mention something important.
These are all valid concerns.
But here's the good news.
Doctors are trained to work with patients who have different communication styles and language levels.
And most doctors really do want to help you.
They'd much rather you ask questions than leave confused.
So, let's give you the language and confidence to speak up.
The big idea. So here's the framework for having a successful doctor's appointment.
Think of it as a conversation where you're both gathering and giving information.
It's not a one-way street where the doctor just talks at you.
You're a partner in your own healthcare.
We're going to break this down into 5 key parts.
Part 1. Describing your symptoms clearly.
Part 2. Asking questions about your diagnosis.
Part 3. Understanding treatment options and medications.
Part 4. Making sure you know what to do next.
And Part 5. Advocating for yourself when something doesn't feel right.
Let's go through each part step by step. Part 1. Describing your symptoms. First, let's talk about how to describe what's wrong.
This is where a lot of people struggle because you need to be specific.
Saying, I don't feel good or I'm sick doesn't give the doctor enough information.
They need details. Where does it hurt? How long has it been happening? How bad is it?
Here's a useful framework. Think about location, duration, and severity.
Location. Where exactly do you feel the problem?
You can say things like, I have pain in my lower back, or my throat hurts on the right side.
I have a headache behind my eyes.
My stomach hurts in the upper area.
Be as specific as you can.
Duration. How long has this been happening?
I've had this pain for 3 days.
This started yesterday morning.
I've been feeling this way for about 2 weeks.
It comes and goes. It's been happening for a month.
Severity. How bad is it?
Doctors often ask you to rate pain on a scale of 1 to 10.
Where 1 is barely noticeable and 10 is the worst pain you can imagine.
But you can also describe it with words.
It's a dull ache.
It's a sharp stabbing pain.
It's a constant throbbing.
It's mild most of the time, but gets worse when I move.
Here's a complete example. I have a sharp pain in my right knee. It started about 4 days ago after I went running. It's worse when I bend my knee, maybe a 6 out of 10.
See how much information that gives the doctor?
Location. When it started, what makes it worse, and how bad it is.
That's exactly what they need to know. Part 2. Asking questions about your diagnosis. Now let's talk about what happens after the doctor examines you and tells you what they think is wrong.
This is called the diagnosis.
And this is where you need to ask questions to make sure you understand.
Don't just nod and say, okay, if you're confused.
It's your health. You have every right to understand what's happening.
Here are some essential questions to ask.
Can you explain what that condition means?
Don't be embarrassed if you don't know what something is.
Even common medical terms can be confusing.
What caused this?
This helps you understand if it's something you did, something genetic, or just bad luck.
Is this serious?
Some conditions sound scary but are actually minor,
Others sound minor but need attention.
so it's good to ask directly.
Will it go away on its own, or do I need treatment?
This tells you if you need to do something or just wait.
Could it be something else?
If you're not convinced by the diagnosis, it's okay to ask this.
Doctors are used to this question, and good doctors won't be offended.
Here's an important one. Do I need any tests?
Sometimes doctors order blood work, x-rays, or other tests.
You can ask why a test is needed and what it will show.
What is this test checking for?
When will I get the results?
How will you contact me with the results?
These are all normal, expected questions. Part 3. Understanding treatment and medication. All right, now let's talk about treatment and medications.
This is critical because you need to know exactly what to do to get better.
And you need to take medications correctly.
So don't leave without understanding this completely.
First, let's talk about prescriptions.
If your doctor prescribes medication, here are the questions you need to ask.
What is this medication for?
Don't just assume. Make sure you understand what it's treating.
How do I take it?
This includes how many pills, how often, and with or without food.
The doctor might say, take 1 pill twice a day with food.
Make sure you understand. You can ask, so that's 1 in the morning and 1 at night?
How long do I need to take this?
Some medications are just for a few days. Others are long-term.
What are the side effects?
This is really important. Side effects are unwanted effects the medication might cause.
Like drowsiness, nausea, or dizziness.
You can ask, what should I watch out for?
Are there any foods or other medications I should avoid while taking this?
Some medications don't mix well with alcohol, certain foods, or other drugs.
Better to ask now than find out the hard way.
What should I do if I miss a dose?
Should you take it as soon as you remember? Skip it? Double up next time?
Don't guess. Ask.
Here's another really important question. Is there a generic version?
Generic medications are cheaper but have the same active ingredient as the brand name.
In many countries, you can save a lot of money by asking for generic,
Now, what if the doctor recommends a treatment that's not medication?
like physical therapy, rest, ice, or lifestyle changes.
You still need to ask questions.
How often should I do this?
For how long?
What should I avoid doing?
How will I know if it's working?
All of these help you follow the treatment plan correctly. Part 4. Understanding next steps. Okay, so the appointment is winding down.
But before you leave, you need to know what happens next.
This is where a lot of people get confused because they're not sure what to do after they walk out.
So let's make sure you have clarity.
First question. Do I need a follow-up appointment?
Some conditions require you to come back and check progress.
If yes, ask, when should I come back?
Should I call to schedule, or will your office contact me?
Second question. What symptoms should I watch for?
Sometimes your condition might get worse or develop complications.
You need to know what warning signs to look for.
What would mean I need to come back sooner?
What symptoms would be an emergency?
This is crucial information.
Third question, can I exercise? Or can I go to work?
Depending on your condition, you might need to modify your activities.
Don't assume. Ask directly.
Is it okay for me to go running?
Should I stay home from work?
Can I lift heavy things?
The doctor will tell you what's safe and what to avoid.
Fourth question. How long until I feel better?
This helps you know what to expect.
If the doctor says, you should feel better in 3 to 5 days, and you don't, you know to call back.
And finally, can I contact you if I have questions later?
Most doctors are fine with this, especially if something unexpected happens.
Ask how to reach them. Is it by phone? Through a patient portal? Email?
And ask what kind of things you should call about versus just waiting until your next appointment.
Part 5. Advocating for yourself. Now let's talk about something really important.
What to do when something doesn't feel right.
Maybe you don't agree with the diagnosis,
Or you've tried the treatment and it's not working.
or you feel like the doctor isn't listening to you.
These situations require you to speak up for yourself.
This is called advocating for yourself, and it's a critical skill.
Let's go through some scenarios.
Scenario 1. You don't think the diagnosis is right.
You can say, I appreciate your assessment, but I'm concerned this might be something else. Can we discuss other possibilities?
Or, I've had this condition before, and this feels different. Could we explore that?
You're not being rude. You're providing information about your own body.
Scenario 2. The treatment isn't working.
I've been taking the medication for a week and I'm not seeing any improvement. What should we try next?
Or, the pain is actually getting worse. Is this normal?
Don't suffer in silence. Call the doctor's office and let them know.
Scenario 3. You're experiencing side effects.
I started the medication 2 days ago and I've been feeling very dizzy. Is this a normal side effect?
Or, I'm having trouble sleeping since I started this prescription. Should I continue taking it?
Always report side effects. The doctor can often adjust your medication.
Scenario 4. You feel rushed or not heard.
This is tough because you don't want to seem difficult.
But your health is more important than being polite.
You can say, I have a few more questions before we finish.
Or, I want to make sure I understand everything. Can we go over this again?
A good doctor will slow down and make time for you.
Scenario 5. You want a second opinion.
This is completely normal and acceptable, especially for serious diagnoses.
You can say, I'd like to get a second opinion before moving forward with this treatment. Can you refer me to another specialist?
Or, I want to be sure about this diagnosis. Would you recommend I see another doctor as well?
Most doctors understand and respect this. What not to do. Okay, now let's talk about some common mistakes to avoid.
Because there are things that can actually make your appointment less effective.
Mistake number 1. Not preparing before the appointment.
If you know you have an appointment coming up, write down your symptoms beforehand.
Write down questions you want to ask.
Bring a list of any medications you're currently taking.
This includes vitamins and supplements, not just prescription drugs.
Being prepared makes the appointment much more productive.
Mistake number 2. Downplaying your symptoms.
Some people say, it's not that bad, or I don't want to bother you.
Don't do this. Be honest about how you're feeling.
The doctor can't help you if they don't have accurate information.
Mistake number 3. Googling symptoms and self-diagnosing.
Look, we've all done it. You have a headache and Google says you have a brain tumor.
The internet is not a doctor.
It's okay to do some research, but don't go to the appointment insisting you know what's wrong.
Instead, you can say, I read that these symptoms could be related to X. Is that a possibility?
That's asking, not diagnosing.
Mistake number 4. Not mentioning everything that's bothering you.
Sometimes people think, Oh, this other thing is probably not related.
But everything might be connected.
Tell your doctor all your symptoms, even if they seem unrelated.
Mistake number 5, leaving without understanding.
If you didn't understand something, don't pretend you did.
It's better to ask one more time than to go home confused.
You can say, I'm sorry, I didn't quite catch that. Can you explain it one more time?
Any good doctor will be happy to repeat information. Useful phrases for doctor's appointments. Let's go through some specific phrases you can use at different points in your appointment.
These are like building blocks you can adapt to your situation.
When you're not sure what the doctor said,
I'm sorry, I didn't understand that. Could you explain it in simpler terms?
could you repeat that, please?
What does that word mean?
When you need more information,
Can you tell me more about that?
what are my options?
Is there anything else I should know?
When you're describing symptoms,
It feels like.
it started when,
It's worse when.
it gets better when,
When you're worried about something.
I'm concerned that,
I'm worried about.
should I be worried about?
When you want to make sure you understand instructions.
Just to confirm, I should.
Let me make sure I have this right.
So you're saying I need to.
These phrases show you're engaged and taking your health seriously.
Bringing support to your appointment. Here's something we haven't talked about yet,
You don't have to go to doctor's appointments alone.
especially if you're worried about understanding everything in English.
You can bring a family member, a friend, or even a professional interpreter.
Many hospitals and clinics offer free interpreter services.
You just need to request this when you make your appointment.
You can say, I'd like to request an interpreter for my appointment.
Or, do you have interpreters available for your language?
If you bring someone with you, they can help take notes.
They can help you remember questions you wanted to ask.
And they can help you remember what the doctor said after the appointment.
There's absolutely no shame in bringing support.
Your health is too important to risk miscommunication. Building confidence over time. Here's the thing about doctor's appointments.
They get easier the more you do them.
The first time you see a new doctor in English, it's going to feel intimidating.
You're learning their communication style, the medical vocabulary, the system.
But each time you go, you'll feel more comfortable.
You'll learn which questions to ask.
You'll get better at describing your symptoms.
And you'll realize that doctors really do want to help you.
So start building that confidence now.
Practice describing symptoms out loud, even when you're not sick.
Write down medical vocabulary and review it.
Keep a health journal where you track symptoms, medications, and appointments.
All of this will make you more prepared and more confident.
And remember, asking questions is not a sign of weakness.
It's a sign that you're taking charge of your health.
And that's something to be proud of.
So let's recap everything we've covered.
Describe your symptoms clearly using location, duration, and severity.
Ask questions about your diagnosis. Make sure you understand what's happening.
Understand your treatment and medications completely. Don't leave with any confusion.
Know what to do next. Ask about follow-up appointments and warning signs.
Advocate for yourself. Speak up when something doesn't feel right.
Remember, you are a partner in your healthcare.
The doctor has medical expertise, but you know your body.
Together, you make the best team.
Your English doesn't have to be perfect.
What matters is that you communicate clearly and ask for clarification when you need it.
Good doctors will work with you to make sure you understand.
And if a doctor makes you feel bad about asking questions, or doesn't take time to explain things, that's not your fault.
That's a sign you might need to find a different doctor.
Before we go, we'd love to hear from you.
If you're listening right now, leave us a comment and tell us,
What topic would you like us to cover in future episodes? Your suggestions really help us decide what to create next.
and chances are, if you're struggling with something,
Other listeners are too.
so leave a comment below and let us know what you want help with.
And don't forget to subscribe. We have many more helpful episodes coming out every week.
In fact, next week we'll be covering how to talk to your child's teacher in English.
Parent teacher conferences can feel intimidating, especially if English isn't your first language.
So we'll give you the phrases and confidence you need to advocate for your child at school.
If you have kids in school, you won't want to miss it.
So hit that subscribe button so you don't miss future episodes.
Thank you so much for listening to Real English Conversations.
We'll be back next week with another real-life topic to help you navigate English with confidence.
Until then, keep practicing.
And remember, real conversations don't have to be perfect.
They just have to be honest.
Goodbye for now.
See you next time.